Minister, sir, good evening. Let me introduce myself. I'm Guy Valenciennes, and I'm chairing this convention on health management. Thank you very much for having changed your program to be with us. There are a lot of us here listening to you this evening, and I'm asking my colleague Brice Gaillet to come along and interview you. You know that you can say whatever you like at Sham, and I know that you do say what you like, so I'm sure this is going to be a great debate. Well, thank you very much indeed. I'm very enthusiastic to be here. I hope you can hear me clearly. Yes, I'm sorry to not be here physically. I'm sorry about that. But technology is going to enable me to catch up on that problem. Right, well, Minister of the Economy, Industry and Digital Issues. The debate today at this convention is open health, from the virtual to the real. Therefore, this is the area of digital issues. Open data is a huge area, including networks, technology, and I know that you are a very high-tech person. There are nanotechnologies, biotechnologies, and also big data. We're going to be talking about all these issues, but my question is going to concern open data. Is France a country of open data? Well, I'll come back to health, but France is increasingly a country of open data, but you've got to know what's behind that concept. In terms of public data, we've improved a lot. When I take a look at the international classifications, we've leapt from 16th to 2nd position, so we've improved in the open government classifications, and we're very, very active indeed in this area, and we're going to continue along the same lines, because with the law on growth and business, we're going to continue opening up public data, and we'll continue in the new legal text and open up to what we call public data. But we have something nowadays which is called data of general interest, and we're trying to identify in which areas we can make progress. The whole point is, does data belong to anybody? It's a legal and economic facet of the issue, which has consequences, because raw data as such belongs to nobody, so it's normal that it should be accessible, and if you do capture it, that means you're making money unduly, and you can see what you can do with the data with statistics, for example, but there's also data you can work on, and through your work make something of it. And it's interesting to see whether we can open up this data at no cost. And we're working on the issue today to see how we can improve. In the coming months, sector by sector, we'll be working on all these issues to see how we can improve things, because if you give people access to data, then you're creating business. You're giving people, other players, the possibility to improve their work and enhance the data even better, to convert it into something else and create something innovative. The whole thing is, you've got to find the right balance between what you can do by making data available, and make sure, on the other hand, that you don't innovate and produce data but deprive people of the money they should be receiving for it. And if you take a look at what you put behind the concept of data and opening data up to the public, you'll see that there's a lot of data in the databases. In the health insurance database, for example, we've got one of the most extraordinary databases in the world, and the Israelis have done some very remarkable things over the last few years with theirs. It's a real treasure trove. But at the same time, the technological breakthroughs going to help us to improve the data, which will be usable and potentially openable by dematerializing medical data and imaging and so on. And in this respect, we've got a second corpus of health data. It's obvious that if we do open these data up, it'll enable us to improve the quality of our healthcare, because it will offer a number of different players to know more and to improve the way they coordinate, and it will also create more activity in this sector. And with big data, you'll be able to improve the way you process it, and you have the preventive and predictive aspects that you will be able to have access to if you, and that's going to change the sector. In terms of health, the data that I've just mentioned is sensitive, and we've got to open the data up, but at the same time make sure that the individual information is safe, especially the sensitive information, because in the health law, which we're currently discussing, Article 47 has led us to open up the data through two different access points. You've got the public data, open data on the quality of care, all the data that has no impact on individual people. And then on the other hand, we give restricted access, regulated access to the more sensitive data. And I think that's the balance that we've got to find. It's a balance at a point in time, but I think we'll carry on talking about this and perhaps go farther still. Well, that's the point. I think we've got to come back to the fact that France is a very open country in terms of open data. We rank 3 on. We have 20,048 databases open to the public at the present time, and another 116 are going to be made available. So we are very open. Your analysis of the challenge at stake, you've just given us your analysis. So do you think we can stay ahead of the crowd in France in this respect? And what role can you play as Minister of the Industry in this respect? Well, I've my beliefs, but I've also got my insufficiency, my shortcomings. There are people in this room that are far more competent than I am, and I'll tell you how I perceive things at this stage. I think that first and foremost, you've got to try and understand the trends in the sector and see where our advantages reside and what we have to catch up on. But the problem is that we've got innovations that are going faster and faster. We've got the challenge of big data to deal with, and that accelerates things too. At the same time, medicine is developing with our social scheme and therefore cost constraints, and then all this new technology that's coming along. So we're in a rather paradoxical situation with a lot of tension, which means that we're going to have to prepare for these changes today. And in my opinion, in many of these situations, we're going to have to adapt our collective choice as well. If we take a clear look at things, in medicine, we're talking about a sector that has changed a lot because people are living longer to start with, but this is going to create other opportunities in health as well. We have more people with long-term disorders. To keep it simple, we die less, but we live longer, but not always in good health. That's going to change the way we care for people as well, with lifelong treatment. And then we also have the new technologies, which are changing things, as you said. And it seems to me that this is at the crossroads of several different trends. And I think this is why we've got to define our roles and see how we can succeed. We already have a position that we've been developing for several years on the biotech and pharma side, but we've also got the emergence and interconnection between genomics, neurosciences, connected objects, and big data. And this sort of magic square that is completely restructuring the sector means that everything is accelerating very fast. And although we are very open and we have the right regulations, I don't know if we're not going to be overtaken by the innovations and the capacity of the sector to change itself. Because when you see what big data can actually do with the available data today, and the crossed breakthroughs due to these transformations, I'm sure that there are a lot of things that we haven't really apprehended yet today. And I want to be very modest because I think there's a huge amount of potential. The whole issue is how can we capture it and how can we support it? And then we'll come back later to the precautions we've got to take. Well, I think that in this subject there is a lot of potential. We've got the existing industry. And here there's a challenge. The challenge is how are we going to use our historical and current advantages to capture the wave? Because we have big pharmaceutical companies, but if you take a close look, you'll see that they're having difficulty in innovating, especially in France. So how can we use the distribution networks and our capacity for action and the big pharmaceutical companies to take this radical turning with the magic square I described earlier? So I think that this is the crux of the matter. It's the industrial aspect that's the more important aspect, not the state. What can we do? Well, we can focus our credits on the more sensitive subjects and support the players. But we've got to change our industry. We've got to change from the classic model, which is less and less innovative in France, and now capture not only the biotech breakthroughs, but other breakthroughs as well. And that's what they're doing in the pharmaceutical industry at the moment. And I think it's very important that the big players do that. And there's another challenge, which is to try and do better on the more critical aspects of health, clinical trials, drugs for innovative treatment, and more customized medicine. And we can do a lot more here, both in terms of the industry and our health, by, to keep it short, doing two things. First of all, going faster, and secondly, focusing on the financial aspects. We're in an economy in which there's a premium for the one who gets to market first and gets the tests through as quickly as possible and has the visas fast. And that's perhaps not what we do best. It didn't cost us too much when the market was fairly organized. We were in a big pharma economy, but today it's starting to be a problem. And I've worked with Maryse Touraine to see what we can do. We've worked on a program called Medicine of the Future. And this is one of the main axes for me. We've got to try and crack down the deadlines. I've seen a lot of startups who are saying, well, we had to fund all the upstream part in France, and we got some funding for innovation, but it went much faster to do the tests in Canada. So that's what they did, and they set up the company there, which is a loss of value for us. We've got to learn how to go faster in France. And I also believe that we've got to go from the culture of inspection beforehand to supporting the tests and checking what's gone on and inspecting them afterwards, which will give us a platform of trials which will help the industry. So speed of execution is fundamental. Sorry. No, go on. Continue on speed. I don't want to come back. I just wanted to come back to funding, because it's not only funding, it's also the industries and the university labs who don't have the same system, the startups and small and medium businesses who don't have the same financial structure. Wouldn't it be better to have the same model for all? Well, if you look at things, you'll find that we have innovation funding that works very well today. We've got the tools to fund, which are used mainly by the big groups, with a tax incentive for research, which works very well indeed. But the mother of battles here, especially in health, is equity. The name of the game is equity, that's it. Because if you take a look at how things actually happen, it's important to keep in mind that we've been funded by debt, and especially in health, we need a lot of equity. Whether it's a startup or a big project, you'll see that we have a capacity to fund projects in France that exists for the first round of talks. The banks play their role, they're there. The business angels are more and more present, and there are other forums that have developed with thematic funds available for the first round of talks, but from the third and fourth rounds onwards, we're in trouble in France. It's a true problem in the health sector in France, because time to market and the duration before you get your product profitable is often long. And that's critical, because it's this funding that means that you can get your startup to grow and make it successful. You can also accelerate things a lot here, because if you've got the capacity to fund these projects just at the moment when you're going to get onto the market and do the clinical trials, the more market share you can take. And that's what's important, which is why I have twinned the subject of speed and funding, because the faster you go, the less cash you burn. The quicker you obtain your funding and on big scale, then the more market share you're going to be take. The winner takes all, as the Anglo-Saxons say, and that is fundamental. And we've got a sort of crack in the market there, because we haven't got the American concept of venture capital. It's related to our fiscal structure and our background. It's also due to the fact that there's no real ecosystem that's ever focused on this. And more recently, between New York and Boston and in Israel, we found these particular suitable to build this sort of economy. So what we've got to do is succeed in developing this venture capital ecosystem, which means that we've got to attract existing venture capital to fund Europe and France. In September next, we're getting the president to receive the big Israeli and Chinese funds to show them what innovation is France, especially in the health sector. We're going to show them what we know how to do, and because often they don't know and they may be interested. And we are going to have to build this ecosystem by pushing the markets more, Alternex and Anternex, and the big groups are going to have to be persuaded to buy these startups to create the critical ecosystem. They're going to come along and see the opportunities, and they've got to see that in these startups in health and biotech, there are some very promising startups in France, and see if a bigger group doesn't want to buy them afterwards. This is where in France we've got another shortcoming, which is why I mentioned the transformation of the big groups. And this is not only true in France. The big groups don't work with startups enough. They've got a captive culture of innovation, which is less and less suitable for the world of today, because this innovation needs fast horses. And we see a lot of labs, small labs, independent labs. And the big groups are going to have to go and seek innovation outside their own group, which will make them more agile and more descriptive, and to help to fund these startups to nourish the ecosystem. And we're going to have to try and develop this with venture capital and more contracts and purchases or takeovers by big groups, so that our startups really do take off. You'll agree, probably, because I know that you're interested in this subject. The problem is that in France, doctors all remember CGI with the MRI issue. General Electric made a fortune thanks to the French MRI. There was no equivalent at the time, and it was sold to GE. And there are companies in France that are extremely innovative with technology that is not available elsewhere in the world. I think you know Monaco technology that does confocal laser. They're the only people who do it. But the other problem is that the startups may save money for the health system as such, but they get nothing in return. And they're saying, well, we take all the risks. We'd like to take half the risks and get half the profits if they come in. Well, I think we've got to make this all more readable, more understandable. What creates the constraints? Well, it's the background in which we live. I know Sacha Loiseau. He's a very talentuous entrepreneur. He's a talented entrepreneur. Well, he's here today. Well, I'd like to greet him then. And he's one of these young people who is really drawing the system upwards. But the constraints in terms of funding from the public sector, the hospitals, has drawbacks and constraints. And when you've got budgetary constraints, and we do have those constraints because ours is a social system, and rather than other systems that are more liberal but less equal for all. And I think that we've got to be more dynamic in the way we manage our system. That's to say, we've got to be able to model the savings that innovation can give our system. At the beginning it'll cost money because it's innovation, but we've got to be able to model the return on investment better, because this innovation is going to change the way we organize our system, including in the public system. It's true that hospital at home is something that can make savings, and prevention is also something that can save us money, and that's going to help us to go for these innovations. And we'll have innovations that will be an investment to start with, but the return on investment is such that we'll be saving money in the long term. And I don't think we can model that sufficiently, and the way we're organized doesn't always enable us to encourage that. And the second constraint, and the President made a commitment to that, was on going faster. Authorizations, visas, tests, trials. And I think that collectively, in terms of clinical trials, it's absolutely crucial for companies such as these. And things are far too slow, and we're still far too angled on prior inspection. And we need to have a clear framework and more inspection afterwards rather than beforehand. But this isn't something that the minister is responsible for. We have external authorities, and very often we have to wait far too long to get things stamped. Now, let me talk to you as a minister. I want to do a little start-up and have a network between the operating theatres so that we don't have surgeons all in their operating theatre. So I go for a start-up, and I ask the experts what to do. As you said, we've got to go fast. And I say 10 million, and the experts say, oh no, 10 million is not enough, you need 30 million, 40 million. And I'm a young professor, and I want to do something like that. What would you do to find the money? Well, I don't know whether your project is good or not to start with, or that's not nice at all. And thank goodness too. I mustn't stand in anybody else's shoes. That's not my job at all. I'd send you to the people who fund these things. That's to say, either the seed capital funds who fund the first round of talks, see who can help you, Sophie Nova, BNB for the first rounds perhaps, and the business angels in the sector too. So that's the first thing. And then at the same time that I'm doing this, I would invite you to go along to the 2 or 3 critical places in the world, do a quick once around the world, and see the key sites in terms of innovation. You can see youngsters in Silicon Valley and Israel going for these innovations, and they're always told to go around and take a look at the others. And it's always good to have a business angel too. That's something that's extremely advantageous. So I send you to go around the world and test the market, to get in touch with Business France and a few funds and do the crucial tests, and then I send you to see the best academics that you know better than I do in your sector to see how robust your project is. And then behind that you've got the platforms, the centres who work on the second and third round of talks, and there's a health centre that could probably support you when you think about the markets. And then you've got the Public Investment Bank, which will give you access to the European one-stop shops. This is key. The money that you can get there could also help you to fund the project. Well, thank you very much for that. But on a more serious note, I know that you're very keen on all these new technologies. I'm not going to go back to the medical records. I don't think that's your subject at all. But there is an ethics issue because of the risks. With all the transparency of this big data, are you going to select the risks, and how can you stop the risks being harmful to the patients and the doctor? I think the impact on ethics is multiple. First and foremost, there's one that you probably are more familiar with than I am. That's the impact on the relationship between the doctor and patient, because the one-to-one relationship they have is obviously going to be affected by innovation, because you've got the machine that circulates data, and there are other things that are going to come between the two. The patient is going to become more and more a player in his healthcare too, and part of the doctor's job is going to change, become digital and dematerialized, and the physician is going to focus more on his added value. But is a software package going to judge and take decisions which the doctor took previously? I think you've got to take a look at those issues. And these are issues that we've got to answer collectively with men of science and philosophers. We've got to start thinking about them, but at one point in time you can't only consider software aspects. You've got to understand that what the doctor judges can't be put into a software package. And this is a dilemma. The dilemma is that if you open up all the data, you'll improve your capacity to prevent, to care for, and to innovate. And one might even say we must open it all up immediately. But as you said so well, if we do that, then I'm going to be affected in my private life. And it's also going to affect my personal data, and we're going to create innovations that are going to break into the social aspects. It's a problem that's not only ethic, but also financial, because we have all the instruments to individualize risks now and separate the good risks from the bad ones. And I might know instantaneously whether I'm a good risk and I'm going to get cared for or not. And who's going to accept to pay for that? And unveiling ignorance in this area is obviously going to break into solidarity. I may be going to have Parkinson's disease. I don't know if I'm going to be cured from it, but all I know is that you're going to pay for my Parkinson's care. in several years' time when I have it. But if I know that right now, that's wonderful, because maybe to start with, I may not have Parkinson's disease, or we may, because it may be preventable, or we may be able to delay the effects. But I know already that everybody's not going to want to help pay for my Parkinson's disease, especially if they don't have it, which is going to create another form of problem, because I may have Parkinson's disease in the long term, but you might have retinal degeneration, and somebody else may have Alzheimer's, and the cost of all this is going to be borne by all. So this is an ethical and financial consideration which is extremely important, and I haven't got the answer here today, but we mustn't hide our faces from it. And the third ethical issue I'm thinking about is the magic square that I mentioned earlier, not something that's already gone farther than we have the mechanisms of artificial intelligence and connected objects and cognitive science gone so far now that ethical choices are being transferred to those who make the software packages, and that's what disturbs me the most. Several of the people here in this room have published interesting papers, such as Laurent Alexandre, who's given this a lot of thought. But this means that ethical reflection is something we've got to start on right away, because the philosophers, the political authorities and other experts are thinking about this today. And if we don't make a choice, then the choice will be made because the software will model them. And I think that this amazing acceleration that's occurred, although we are still focusing on the questions of the past, are something very urgent. And we've got to apprehend intellectually and conceptually and philosophically these changes and what they mean. Minister, I'm prepared to fund your Parkinson's if you fund my Alzheimer's, and we both fund our colleague's retinal defect. In 2011, we got together everything digital in Paris. It was organized by Boris Levy with Bill Gates and goodness knows who. And the president of the time gave a very good speech on the role of the politicians, and said that we have to make sure that these breakthroughs are ethical. And the answer was, you're right, President Sir, but we go faster than you do. So what do you answer to that? Well, it's true when you think about laws, and there has to be some sort of framework. Succeeding in finding more malleable ways of going about this for social and financial regulations is true. We've got to be more plastic in our capacity to make the laws. I'm convinced of that. But what we're saying now, and what gives our economy more capacity to reallocate the factors faster in terms of capital and work, is important too. And that goes far beyond health. But the question that we're considering now justifies putting the ball down right now. Sorry about the football metaphor. But the flows continue, and nevertheless we're going to be victims because we're asking ourselves more and more ethical questions today. The innovation system, which is something that you see clearly when a lot of these players are coming in to the political area, which is ours, and if we don't take a clear look at these main issues today, we are going to miss out. And I think at the same time we'll be pulling the system along, but as if it had hemiplegia. And what's amazing in this new economy is that it's deconcentrated. Intelligence is in large numbers. So the economy is not between the hands of just one or two that structure the offer. We are now talking about collective intelligence. It's our duty to take a look at what the collective preferences we want to give to this economy. That's the real political issues. Laws are something that will always go more slowly. But we've got to have a framework, because it's not the people who are wonderful researchers and make the software packages and who are very talented who are going to be able to define this, because they capture value, because they've got an innovation, a breakthrough that's going to change the world. But it's not up to them to define our ethical choices. And we've got to have an open debate. I'm not saying that I am going to have to take a look at this and tell you what the right ethical position is. I'm saying that this innovation is growing fast, and a democratic debate has to grow too. And it's far too absent today. Debate on medical ethics, the right government, are fundamental debates at this time, as I speak to you, not to stop things happening or to try and follow, but to support the changes and give them a framework. Well, thank you very much indeed for the reflections that you've shared with us. I know that it's a subject that you're extremely familiar with. Thank you, Emmanuel. Thank you very much indeed. Well, thank you all too. Thank you all very much.
Merci à vous. Merci à vous.
Sorry once again to not be with you physically, but I'd be extremely interested to read what you have done here during the conference, because I will have left more questions than answers, more issues raised than answers, but I've shared my own queries with you with a lot of humility, and I think we need a lot of understanding and teaching, and be very participative. Thank you. Thank you, Minister Sir. We'll be with you again.